It's 9 o'clock. We're going to get started. I am Dr. Teresa McKenzie. I am the Accessibility Coordinator at Ohio University Southern. I'd like to introduce you to our Associate Dean, Dr. Salome Naromale.
All right. Thank you very much, Teresa. Good morning again. My name is Salome Naromale, and I'm the Associate Dean of the Ohio University Southern Campus. So on behalf of the whole university, I'd like to welcome you to our 6th annual Envision Access Conference. And first of all, I'd like to thank Dr. McKenzie and all the people who worked to put this conference together, especially for persisting when it looks like we may not have this conference this year. So kudos to you for persisting and making this happen this morning. So thank you. I'm really excited about the topic of today's sessions. The first one on creating an inclusive work environment for employees with invisible disabilities. And then the second one on perspectives of college freshman students with disabilities. I think that these are relevant topics for any time in history, but I think they're particularly timely today, considering the challenges that, educational institutions, both universities as well as K through 12 grade institutions are facing, and society in general. So my hope today is that, through the presentations and through the conversations, that we begin to reflect on ways that we can support everybody in society with the challenges that we're facing, both the abilities and the disabilities, and also have acquire new tools, for our toolbox to enable us to continue to do the work that we do. So it's really an honor to be here this morning and to see all the participants here. So I hope you have a really good day. So thank you very much. Bye.
All right. Thank you, Dr. Naromale.
Thank you.
Again, good morning, everyone. It is my honor to get our first session started. I am the moderator for this session. Today, we are going to meet Dr. Josephine Bennett. The session title is It's Not Magic, Creating an Inclusive Work Environment for Employees with Invisible Disabilities. I am the Veteran Services and Accessibility Coordinator here at Ohio University. I'm also the chair of the Envision Access Conference Planning Committee. I'll be your moderator for this session. But before we get started, I want to take time to thank the staff of Deaf Services Center in Portsmouth, Megan and Christy, who will be our interpreters for today's sessions. You will see them throughout. So again, thank you both of you for coming and doing this today. Your presenter this morning is Dr. Josephine Bennett. Dr. Josephine Bennett is an experienced adjudicator who has worked performing vocational analyses, disability assessments, and preliminary hearing evaluation for both state and federal governments. For over a decade, Dr. Bennett has worked to understand the physiological and psychological factors that impact sustainable employment for individuals with disabilities. This includes understanding barriers that prevent individuals from entering the workforce, as well as assessing functional capacity and limitations in the presence of certain medical and psychiatric conditions. She also works as the Assistant Director of HR Data and HR Advisor for Everett Advisory Partners, which is a consulting firm designed to help address and resolve workplace challenges across numerous industries. Dr. Bennett obtained her Doctor of Business Administration degree in Human Resources from Liberty University, her MBA from the University of North Alabama, and her Bachelor's of Science in Business Management from Jacksonville State University. She also possesses certifications in SPSS, SAS, and Diversity, Equity, and Inclusion. Her skills in quantitative analysis have given her the opportunity to aid organizations and individuals with leveraging data to provide valuable insights into the decision-making process. Dr. Bennett also utilizes her data analysis expertise to assist doctoral students across the country with data analysis and navigating their dissertation process. So thank you, and without further ado, I'm going to turn it over to Dr. Bennett.
Thank you so much for that introduction, Dr. McKenzie. I appreciate it. I'm really excited to be here at the Envision Access, the 6th annual Envision Access Conference. And I really wanted to be able to share through my experience And this is really on both sides in understanding what prevents individuals from entering the workforce, as well as understanding how they function within certain roles or on their jobs in the presence of certain disabilities. So I'm excited to be able to share that. And I'll actually will go ahead and get into the presentation that I have today. I will have the opportunity for questions. If you have any questions at the end or need any specific information, I am always an open book and willing to share. And so I'll start my presentation. And let's see. Screen bigger. Okay. And so as she mentioned, the topic of the session is It's Not Magic, Creating Inclusive Work Environments for Individuals or Employees with Invisible Disabilities. Now, I would like to start the session off with basically just talking about what are disabilities. Now, according to the CDC, or Center for Disease Control, disability affects approximately 61 million, or nearly 1 in 4 people in the United States. And this actually shows that disability affects more than 1 billion people worldwide. Now just think about that, 1 million people. The Center for Disease Control, they actually define disability as a condition of the body or the mind that makes it more difficult for the person with the condition to do certain activities or interact with the world around them. Now, when we're looking at disabilities, or what are disabilities, there are really 3 dimensions of disability that we'll look at, and this is based on information from the World Health Organization. And those 3 dimensions are impairment, activity limitation, and participation restrictions. And when we say impairment, we're looking at really a loss of function or ability, and these can either be structural or functional. But looking at a disability, the disability exists because there is some type of impaired ability relative to the usual standard of an individual or group. Now, when we say disability, we're looking at generally 4 types of disabilities. We have physical, we have intellectual, we have mental, and we have sensory. And when we say physical disabilities, these are the disabilities that affects an individual's physical capacity or their mobility. And an example of these might be amputations, cerebral palsy, spinal cord injuries, or muscular dystrophy. Now, these generally fall within the musculoskeletal and the neurological systems. Now, the second type of disability we have is intellectual. Intellectual disabilities are usually determined based on an individual's intellectual capacity as established by IQ testing. And generally, these are individuals with IQ scores at or below 70. And these are the individuals that are considered to have intellectual disabilities. Now, some of the diagnoses for individuals with intellectual disabilities are maybe Down syndrome or fetal alcohol syndrome or autism. Now, the third type of disability that we're looking at is mental or mental disabilities. And these disabilities generally affect how an individual thinks, how they feel, how they behave, and how they interact with the people around them. Now, examples of mental disabilities include anxiety, depression, schizophrenia, PTSD, or certain personality disorders. Now, the final disability that we want to take a look at are sensory disabilities. And sensory disabilities are disabilities that affect the senses. And these are impairments that may affect the individual's ability to see, their ability to hear, their ability to smell, their ability to taste. Now, an example of these might be hearing loss, vision loss, or other sensory processing disorders. Now, in understanding what disabilities are, let's take a look specifically at what invisible disabilities are. Of course, as you can see, we have a wide range of disabilities that can exist within the workplace. But our focus today is going to be on invisible disabilities. So what exactly is an invisible disability? Invisible disabilities are conditions that can't be seen from the outside, but it impacts the individual's movements, it impacts their senses, or it impacts their activities. Individuals with invisible disabilities, they can experience fatigue, pain, or mental disturbances. And invisible disabilities can exist within any of the disability categories that I mentioned before. Now, of course, if you were to, let's say, see someone in a wheelchair or using a cane or with a hearing aid, you might immediately think, hey, this person has some type of disability. And for some, when we see individuals with more visible disabilities, we justify our actions. Maybe we justify their use of the handicap parking outside the grocery store, or we may hold the elevator open for just a little bit longer. But what about those individuals who have disabilities that can't be easily seen? Do they always receive the same treatment? The reality is they don't. And oftentimes it's a challenge, and this is what we are discussing today. Now, an invisible disability can include, but it's not limited to, cognitive impairments, brain injuries, autism, chronic illnesses like multiple sclerosis, chronic fatigue, chronic pain, fibromyalgia, deafness or hearing loss, low vision, anxiety, depression, PTSD, dyslexia, ADHD, diabetes, and Crohn's disease. And one of the things about invisible disabilities is that oftentimes these may be individuals with psychiatric disabilities, and they make up a large portion of the invisibly disabled population. Now, of course, the main factor that you're looking at when you're looking at invisible disabilities is that you're unable to see the disability. So this means that you may not be able to see the impact of the disability. And candidly, the validity of the disability is not related to your ability to see it. Now, there are things that we want to remember or to keep in mind when understanding invisible disabilities. First is when individuals have invisible disabilities, there are no visible supports to indicate a disability, such as canes or wheelchairs or the use of sign language. What we also can consider is that even though they are invisible, they can still wreak havoc on an individual's ability to carry out the tasks of their day-to-day life. Now, the disability may be managed through medication or behavior, and these may be for impairments such as diabetes, asthma, epilepsy, or psychiatric disorders. Now, the other thing that we need to remember is that in the workplace, it needs to be documented. And it needs to be documented to ensure that there are reasonable accommodations under ADA. Now, one other thing that we want to remember is that individuals may be experiencing some type of physical or emotional pain. And with this, it's important to keep in mind that as you develop ways to interact and respond to individuals within the workforce, that they may have things going on that you just may not see. Now, what is the importance of creating an inclusive work environment? For decades, people with disabilities have continued to push employers to follow both the letter and the spirit of the law regarding disabilities in the workplace. Because the reality is that people with all types of disabilities, they face adverse circumstances in the workplace. And even more so with invisible disabilities, as they may face a different type of discrimination than others, for instance, being accused of imagining their symptoms or their symptoms not even being believed. Now, what's interesting to keep in mind is that employees who have disabilities, they don't and they can't shed the complexities of their physical and mental selves while they're at work. This is who they are. Now, in a 2017 study, the Center for Talent Innovation, they identified that 30% of white-collar college-educated employees had a disability, but only 32% self-identified as having a disability. So that's 32% of people of the 30% who identified as having a disability. Now, 62% of the employees with disabilities had an invisible disability. Now, what this lets us know is that people go through their lives, including their work lives, not only not revealing that they have a disability, but also without revealing what they are experiencing and how it is impacting them. And with that, we are challenged to create work environments that eliminate the stigmas associated with disabilities. Now, what we want to look at, we want to look at really strategies that support inclusivity within the workplace. And that means really taking a look at disability inclusion. Now, disability inclusion means that we are seeking to understand the relationship between the way people function and how they participate in society, and making sure that everybody has the same opportunity to participate in every aspect of life to the best of their ability and their desires. Now, a robust disability inclusion program makes it easier for all employees to perform at their highest potential. And when this is done, it promotes a culture that celebrates differences. It encourages employees to bring their whole selves to work, something that most forward-thinking companies want for their employees. Now, disability inclusion, it reaches beyond just compliance with the law. What it means is that you proactively support inclusivity within your organization. And this proactive support, it has an important and meaningful impact on your employees, on your customers, and your communities. So the thing to keep in mind with disability inclusion is that representation is key. And it is key in creating meaningful and genuine inclusion. And so what this says is that the staff and leadership within the organization has to include a diverse range of employees and perspectives. Now, including individuals with disabilities in everyday activities and encouraging them to have roles that are similar to their peers who may not have a disability, that is what disability inclusion is. And so this involves more than just simply encouraging people. It requires ensuring that adequate policies and practices are in place that affect the community and the organization. Sorry. Now, what we want to look at as far as specific strategies in creating an inclusive workforce. These are things that we just want to note and keep in mind. The first thing is that we want to create an environment where employees feel comfortable with disclosing their identity status. And they feel more comfortable presenting their authentic selves when they know that they work in an inclusive environment. Now, the second thing is to review the accommodations that your organizations offers for people with disabilities. Now, of course, ADA requires accommodations to be made in the workplace for individuals with disabilities, but you want to ensure that you are creating a way for individuals with visible and invisible disabilities to perform their job at or above expected level. And you can't really say that you're creating an inclusive work environment without providing the appropriate accommodations. Number 3, you want to ensure that your organization is offering support and services for people with disabilities. Now, in offering support, this might include making sure that your mental health coverage is included in your company's health plan. It might also include promoting free services that are a part of the employee benefit package. And it might include maybe health coaching to help reduce stress. Number 4, never assess an individual's disability based on what you see. Now, when you make an assessment of an individual's disability based on what you see, you've made a conclusion about the person when you have no idea what they may be experiencing or feeling. Number 5, be open and proactive with requests. Now, as I mentioned earlier, ADA provides that organizations have to provide accommodations, but the attitude that you take towards providing or towards the request is up to you. Now, the goal should be to make it clear that if accommodations are needed, that you'll be happy to make that accommodation. And don't just say it, but mean it. And that means that you will fulfill the request within a reasonable amount of time. Number 6, create signs or displays supporting invisible disabilities. Now, creating a sign or display that shows your support for invisible disability really acknowledges that you understand that disabilities come in all shapes and sizes. And number 7, provide staff training. And this is really ensuring that all members of your staff understand all types of disabilities. And the reality is that oftentimes the lack of understanding regarding disabilities can lead to damaging implications. Now, I want to just take a look at what examples of what inclusive accommodations for invisible disabilities might look like. So let's say if we had an individual with chronic pain. Now, a person with a chronic pain condition, they may need a flexible start time or break time to take medication. They may need additional time to complete certain tasks, especially if they are experiencing some type of pain crisis. For anxiety, an individual with anxiety may need to limit their interactions with the public. They may need to work in settings where they only interact with a few people. They may need flexibility in their arrival time at work, especially if they experience anxiety while driving. Learning disabilities. An employee who struggles with maybe a working memory due to a learning disability, they could receive written instructions for their job duties instead of relying on verbal discussion. They may need complex instructions broken down into simpler instructions. PTSD. Someone with PTSD might not be able to work in environments that experiences frequently loud noises. Their accommodation may include avoidance of situations that are similar to or remind them of their trauma. Now, as with any disability, you want to ensure that the accommodation that you are providing is to enable the individual to perform at the same level or higher level than their counterpart without disabilities. Now, this actually concludes my session for this morning, and I wanted to open the floor if there are any questions or any clarifications that any of the attendees need. Just feel free, type it in the comments and let me know.
Thank you, Dr. Bennett. I do have a question. I actually probably have several questions, but we'll start with the first one. So when you talk about invisible disabilities, I know there's a guidance that long COVID is now included as something that could be a potential disability, and it would be an invisible disability. Do you know if employers are taking the time to include that or having conversations about that? And how is that impacting how accommodations are applied in the workplace?
Yes, they are, and that's a really good question. But yes, and it's actually an area that is continuing to be developed as some of the what we call long haulers, that some of their symptoms are still being realized. And just in my experience, maybe what some of those limitations or things may be within the workforce or that individuals may be experiencing is it may be problems related to their breathing or fatigue. Some may experience tremors, and and a good portion of what they may be experiencing, they may be invisible. They may not be as visible. And as research is continuing to be conducted on what these residuals are related to COVID. Yes, employers are, because COVID is an impairment. It is a condition that is considered a disability. And the residual effects of it are, and employees have to consider the impact of COVID and the residual symptoms within their accommodations. So if they are providing accommodations and an employee expresses, that they have residuals from COVID, the employers do have to accommodate. But like I said, I don't want to say it's a long process, but as research is still being conducted, they are still developing what these accommodations look like. And of course, in your experience with providing accommodations, a lot of times they rely on doctor statements, information from the doctors, on what these limitations might look like or what these accommodations might look like in the workforce. And so, yes, they are, of course, in conjunction with doctors or with physicians and medical staff.
Do you know if there is definitive criteria for determining long COVID versus someone who had COVID and they're still having symptoms 2 weeks, 1 month, 3 months out? Do you know if there is a definitive criteria or a time frame for a long COVID diagnosis?
I have not come across it, but in my role, and like I said, or as you shared, I make assessments for individuals with disabilities, and for individuals with COVID. When we are evaluating, we're looking at, what their current symptoms are. And when they have symptoms related to COVID, then we consider that, as a long-term, until we have longitudinal evidence that shows otherwise, then we look at what those long-term effects are. We look at what their current effects are, and we just consider it long-term until we have, like I said, additional evidence that shows otherwise.
Okay, thank you.
No problem, you're welcome.
Are there other questions? No? Well, I have one. I told you I had more than one. So you talk about creating an environment, and you talk about a couple of things that you can do to create that environment, such as signage that shows support for invisible disabilities. What are other ways besides training and these things that employers can do to show support for individuals with those invisible disabilities?
So one of the one area that I like to talk about, but it's sometimes considered an abstract concept, is culture. What is the culture that you are building around disability? And when I say culture, what's the environment that individuals with disabilities have to operate in? And so I'll just provide an example. Let's say you have an individual that may be experiencing chronic pain. And in order to avert those pain crises, they have to take medication at certain intervals. Well, as a part of the employment policy, this individual has to be at their desk or has to be at a certain location until their break. So they have to do, let's say, maybe 4 hours at a time, but they need the opportunity to take a break every 3 hours. Now, the attitude that you take towards this employee and providing that accommodation, that establishes basically the culture in which you are establishing for individuals with disabilities or invisible disabilities, because you don't provide accommodations for this employee to take the medication to avoid the pain crises, then you're basically giving the impression that you're not accepting of individuals with disabilities that you can't see. And so I said all that to say it's to create a culture that embraces individuals with all types of disabilities and recognize that maybe these accommodations may not look like the accommodations that I'm used to perform or providing, and being open-minded about what those accommodations are. Now, in my role, and I know that when most employers, they get letters or notes from doctors regarding, what those accommodations may be, but oftentimes in my role, I'm able to glimpse inside of records, medical records. And, you see the complaints, the consistent complaints, how even medication sometimes doesn't control the impairments, but, it gets to the employer and they are hesitant to offer accommodations because they feel like, hey, this may not be as bad as what the doctor is saying. But on my end, I'm looking in medical records and I see, hey, when this person is experiencing pain, they have some pretty significant limitations in their ability to function. And so it's just really understanding and creating that environment where individuals are able to, as I mentioned, present their best selves, even if that means that we have to provide these extra opportunities for them to perform.
Okay,